post-NEP 2020, how do you think private universities like Malla have the scope of redefining higher education in India?
From the student's point of view, what I feel is
Been a part of ET Annual Education Summit, wherein you were on a very important panel where discussion was done on AI at rate 2047. So can you please elaborate?
we all talk about artificial intelligence in education, but implementation, execution is.
There's a concept called industry ready or future ready professionalism that is in vogue right now. So it's much spoken about in the field of IT, but do you think that can be applicable for medicine as well?
They were not industry ready. So there was a gap between education and skill.
What do you think are the biggest challenges or setbacks that the Indian education system is, especially the higher education system is?
Finally, after completing their BDS, they don't just have to work with the chair, they have to also work with all these equipments.
So ma'am, being a gold medalist yourself during your studies, so like you have mentioned, technology is everywhere right now. But if you see, it's always a double-edged sword. So academic excellence and rigor is on one end, and adapting to the rapidly evolving technologies on the other end. So since it is evolving at a rapid pace, even students might have some confusion in that part. So how does maintaining both these aspects stand at a bay?
Like, the entire education fraternity not to stop using your brains. Please use your brains.
So ma'am, you have been a firm believer in CSR activities, and also Malla group of institutions have been emphasizing on giving it back to the society. So can you please elaborate on this topic?
In our campus, that is Malla Vishwa Vidyapeeth, we are running 2 hospitals, 2 teaching hospitals, absolutely free of cost. Everything is free of cost from day one.
Hello, years. 5 leaders, 5 game-changing conversations, and 1 unstoppable platform, Bizz. As Bizz completes 5 glorious years in association with HMTV, it's a moment of pride. Today, we are honored to host a trailblazer in education and medicine, Dr. C.H. Preeti Reddy, Chairman, Malla Vishwa Vidyapeeth, Hyderabad. Hello, ma'am. Good morning.
Good morning.
It's an absolute pleasure having you with us on the Bizz show. So, ma'am, you have been a strategic voice in shaping the future of Malla group of institutions. So, how do you see the education system in India moving forward, and what steps are you taking to, move it in the right direction in terms of medical education?
I think education is a huge thing, and I think it's a brilliant weapon to change the society or the world. So now I think about education, I would say that of course the conventional way of teaching and whatever the statutory bodies are running is of course supporting the students, and being a doctor or an engineer is anyone's dream. But apart from that, there are few areas which I think there is a lot of scope to expand. So especially in, I would say, in allied health professions, because everyone wants to be a doctor, if not then a dentist, or else a pharmacist, and or else get into other areas like nursing. But I feel like apart from all these, even Ayurvedic and homeopathy, there are few areas in allied, like I would say, like emergency and critical care, BSc. Like all these BSc courses in different areas of eminence, which is absolutely important, and I think students should look forward to become one of them. So I think one of them, emergency and critical care is one of them. Emergency medicine and critical care, then radiology and imaging, cardiovascular technology, and anesthesia and operation theatre, medical biotechnology. So all these courses, I think they need to concentrate. Apart from this, there are also few areas in hospital sector which have not been concentrated enough, which I feel. Like, for example, there is a need to start a few BSc courses in cosmetology and dermatology. Okay. Now, everyone in the field of, whenever they start any kind of a cosmetic clinic, they are in need of technicians. Okay. Yes, of course, I know it's very difficult to become a dermatologist, to get a MD seat in dermatology is uh, extremely difficult, I would say. And but even if you are an MD dermatology, they need technological support to perform the lasers. There are different kinds of lasers in dermatology, and a technological aspect or a technician in these areas are important. Apart from that, we can talk about reproductive sciences. Everywhere infertility is growing, and IVF centers there, they've been opening in almost like every 2 to 3 kilometers. You can see an IVF center. So IVF center, yes, of course, you need a gynecologist who is an expert in uh, IVF. That is, and apart from that, clinical embryology and ART, that is artificial uh, reproductive technology, is also important. And in all these areas, of course, they are using a lot of technology. Again, we need technicians in these areas too. So these are the two prime areas. Apart from that, I can also say that in a hospital industry like CSSD, that is Central Sterilization Department, I feel there is a lot of lack, there is a lot of loophole in this particular area, because it's very difficult to find a CSSD technologist, believe me, a CSSD technician, I would say. And I think BSc in CSSD technology is also, I mean, I think will really add to the society needs, is what I feel. So there are many such programs.
Ma'am, beautifully explained. So post NEP 2020, how do you think private universities like Malla have the scope of redefining higher education in India?
Yes, of course. I think if you can see, NEP 2020 is what it was required, because we all were had the same way of fixed curriculum, the same archaic way of like the education models. Okay, the education delivery models. It's it's been yes, of course, a change was required, because there are a lot of rigid boundaries between two particular departments, like medicine and technology. But now technology is integrating in each and every field of education, not only just education, in even healthcare. We are all talking about artificial intelligence. I think the growth of artificial intelligence has literally made it mandatory to break these silos, and like where all the other departments can come integrate with technology and form a new area, like a multidisciplinary or interdisciplinary education, flexible curriculum. Okay, so this all, it's mandatory. Okay, I think from the student's point of view, what I feel is a personalized education, a personalized, like artificial intelligence allows you to have a personalized learning. So I feel it's very important to deliver. The time has come where we are here to deliver a universal, I would say, high quality and personalized learning for everyone and everywhere. Like, with the availability of a lot of online courses. Okay, now if you see, there are people who are in rural areas, not everyone can come, leave their place, and, study in different universities. So I think with the comments of AI, I would wherever they are getting educated. So NEP 2020, I would say, like it delivers us a lot of scope in multiple exit and multiple entry. Like somebody wants to enter in the second year, somebody wants to quit in the second year, and then there are different areas, reasons. In India, I think the reason why people are getting educated is more for job, to seek a job, right? So I think job oriented education system, skill development is the need of the hour.
Yes, ma'am. So taking a cue from your answer, if we see like you have a lot of experience and expertise and a solid background in medicine, so like you have mentioned AI, telemedicine, robotics, these are all becoming advanced in all the fields. So there are two aspects to it. One is the patient care and other is the healthcare education. So how do you think universities can balance both these aspects?
Of course, they have to balance, because when you're running a university, you need to balance each and every corner. That's what you're meant for, right, as an administrator. And if you don't balance, then there's no point in being a university. if you're a medical university, at one end you have an education, another end you have a hospital, and in fact it makes my job easy because they go hand in hand. Because in our university we started this new school of digital health sciences, so that made me mandatory to start, like, to digitize, or the digital transformation of the entire hospital infrastructure, like, HIMS, and then whether it is electronic health records, everything has to be done. So we are now created a data center where all our clinical material is being converted into digitized format. So, like, upgrading all the computers, all the equipments in the lab, like, so that all the reporting of, like, lab reports or radiological reports, the OPD is now digitized. Everything which has been entered in the OPD is now available in your computers, in your laptop, everything. So I think things have become more paperless, because all the records, we used to have a room full of records. So hospitals is records. So all this has become paperless, has been digitized. And yes, of course, it is being used by our students in digital health to understand the, like, multiple things, like what kind of patients are now more prevalent to which kind of a disease. We can see the shift in, like, a lot of say for example cardiac ailments in between 40 to 60 years, so like that. So it's an entire study. So artificial intelligence is more, is in healthcare, is in education. Now, coming to education, for example, now studying anatomy has become easy. It's become more creative. When in my times it used to be cadavers, or it used to be a verbal discussion or books where we used to imagine the things. Okay, but now there are so many companies and organizations. They've started this AR VR, like this
Yes.
augmented reality, and they have planned to. They have these applications where you can see the heart right in front of you. You can rotate it. You can see the arteries, see the entire anatomy, cut through it, open it. So, it has become so easy for the medical educationist that, you can enjoy the entire thing. Yeah.
So, ma'am, you have been a part of ET Annual Education Summit, wherein you were on a very important panel where discussion was done on AI at rate 2047. So, can you please elaborate?
Yes, of course, I thank Economic Times, where they have, called me as one of the panelists. And I was a part of very renowned people in the country who are dealing with the new era education system. And yes, of course, I think we as a university, we need to attend such events so that we know what's going throughout the world, and we can explain what we are doing in our little campus. So yes, of course, I feel absolutely privileged to be a part of it. It was all about artificial intelligence and into education system, and also about shaping the future of education in India. Okay. So of course, I think I want to be a part of it. We want to shape it in a right way. Everyone was talking about how we all talk about artificial intelligence in education, but implementation, execution is a task. Okay. So because all these professors who are senior, uh, they don't have much of knowledge in computers or in technology. So for us, especially in medical college background, first we need to train our faculty,
Absolutely.
and then start using this technology in our campus. So we have done that. We have an administrative team. Like for example, in our campus, yes, of course, we are using AI left, right, and center. Uh, Especially in administrative works, is what in academic excellence, we are trying to have these AI tools or AI tutoring, where they help the students to learn in a personalized way. Okay, like, making us easy to tailor the lessons, the assignments, or the quizzes, which is student specific. Okay, so that is one. And then, the students can also enjoy, they can have their own quizzes. They can do their self assessment, where they understand at which level I am. So now everything, and it's everything is real time. Like the beauty of artificial intelligence is being real time.
Hmm.
In fact, in our everyday needs, we use AI in our mobile. So why not in education system? So then now the faculty is everything, the timetable, the records, the planning of the entire administrative work of the faculty have come down because they've been now empowered by AI. So the AI does everything. So now they have a lot of time to concentrate on the students. That is what is happening. And then we also, it's easy for us to now manage the admissions, the admission process, the hostels, the transport, how many students, the attendance,
Hmm.
how many students are available, how many students, whatever is the, the due amount, and how many students are opting for hostel, transport. So it's a make our administrative thing also very easy.
Yes, ma'am. So there's a concept called industry ready or future ready professionalism that is in vogue right now. So it's much spoken about in the field of IT, but do you think that can be applicable for medicine as well?
That is applicable not only just in medicine, everywhere. See, today, as I told you, the conventional way of studying, like, yes, I wanted to be an engineer, used to be a pride moment. It is still now. But then, are you ready for the job? Is the question.
Absolutely.
Okay. So, as I told you, the old or the archaic way of, delivering the education system and the fixed curriculum, they used to be engineers, but with no skill, with less of practicality. And yeah, more of theoretical. So after the engineering, the industry needs something else. And these people, like, the conventional way of studying, they have the knowledge, but they don't know like where to seek the job, what to do if I get the seek the job. They were not industry ready. So there was a gap between education and skill. Now with this NEP 2020, and of course so many universities coming up, we see to it that the hands-on training is available from day one. Day one, everyone has a laptop. Everyone knows that, okay, this is what I want to be. These are the companies which are ready to hire me, and this is what they are expecting from me. And in fact, tie up with these industries when they come into a campus. They're coming into the campus and they are trying to make our students job ready. So they will tell that, we have to work on these applications. This is what, then only if you're thinking of joining Amazon, if you're thinking of joining Microsoft, these are the skills we are looking for, and they get trained accordingly. Today's students are brilliant. Students are always been brilliant, but I think their actual skills are now being put out, like, they've now been extracted, and then they know what to do because of the social media, because of everything, the internet. They know that this is what I want to do, and so we are guiding them towards that area. So now the skill development and adding technological advancement, and what you say, embracing the technology is yeah, it's there in our campus, and this is what is required.
So beautifully explained. Ma'am, what do you think are the biggest challenges or setbacks that the Indian education system is, especially the higher education system, is facing?
Yes, of course, which as I told you, that everything is like a fixed curriculum now. Okay, like for example, in MBBS, we know the years and the topics and the semesters. If at all, say there is a semester where you teach them digital health. See, after COVID, we all have understood that, without knowing anybody, without knowing your laptop or without knowing how to use your applications, the telemedicine, the teleconsultation has come into focus. So I think it's all about receiving anything, anywhere now. If even you are abroad, you can be treated, you can be heard, you can be monitored. This everything is possible all because of, like, COVID has made us learn multiple lessons. And one of the lesson is where now the doctors, we need to know digital health. So if at all in MBBS, if we have a curriculum or a part of a semester where they are being taught digital health, so it makes their job easy. After they complete their MBBS, it's easy for them to start with telemedicine and take care of the, like, they can live up to the fast moving world, right? But then now, as you see in MBBS, they don't have this course digital. So at least after MBBS, they can do a online course or an offline course or some 6 months certified course where they understand digital. I feel these things we need to upgrade our system. The statutory bodies should think about it and should add into their present curriculum of whether it is, BTech or whether MBBS or dental. Like in dental, after doing BDS, most of the people either they work in a dental hospital or they open a dental clinic. How many dental clinics can you have? Okay, so if we make them understand the beauty of digital dentistry. Okay, digital dentistry is like, there are, oh my god, if you in dental especially, so many equipments have come up where the technology has given has went beyond even our thought process. It's easy for for diagnosis. It's been the treatment, the accuracy, the precision, everything has improved in dental. But then the old way of learning BDS, that is Bachelor of Dental Sciences, and not inculcating the digital dentistry as a part of their curriculum, and make them more challenging. Because finally, after completing their BDS, they don't just have to work with the chair; they have to also work with all these equipments to keep them updated with the changing world. So these silos have to be broken.
So, ma'am, being a gold medalist yourself during your studies, so like you have mentioned, technology is everywhere right now. But if you see, it's always a double-edged sword. So, academic excellence and rigor is on one end, and adapting to the rapidly evolving technologies on the other end. So, since it is evolving at a rapid pace, even students might have some confusion in that part. So, how does maintaining both these aspects stand at a bay?
This is a very good question, ma'am, I would say, because I think using with the all these AI tools and everything, using them is, of course, it's like it's a big support system, but using it ethically, how to use it is one aspect, but where to use it, okay, and how much to use it is important. So this balance is absolutely important. I think not only just in AI tools or in technology, even in our daily life, everything in limit is good. Everything beyond limit, you lose your control. So this the same thing even applies to technology. Of course, we as this thing, I would say, we will be, I won't say we'll be dependent, but yes, of course, we need all this technology to make our job easy. But at this same time, I request that, the entire education fraternity, to not to stop using your brains. Please use your brains, as well as use the technology where and when required to make your job easy. Don't be completely dependent on artificial intelligence or technology, because finally they are all equipments that is considered. But yes, you as a human being, your brains, your thing, you need to keep yourself proactive, and you need to. So finally, artificial intelligence can support your judgment, but the final decision has to be taken by human being. Okay, so that you need to be still be alert. If even you are using technology, you yourself have to still be alert and take the final decision. And I think there is a lot of myth. They say that artificial intelligence is replacing the teachers or manpower. That's not true. I would still say it. We all should be human led. Human led, and not artificial intelligence or AI is just for your, what you say, for efficiency.
Hmm.
I would say human led is the purpose, should be the purpose, whereas artificial led is for efficiency. So nothing can replace human, is for sure. If we say in the education system, if human is a heart, so AI, artificial intelligence is the brain or is the mind, which will assist us to do well. So I would say that it's not the complete mind, but it assists the mind to take care of all the complicated work.
So, ma'am, you have been a firm believer in CSR activities, and also Malla group of institutions have been emphasizing on giving it back to the society. So, can you please elaborate on this topic?
In our campus, that is Malla Vishwa Vidyapeeth, we are running two teaching hospitals, absolutely free of cost since last 15 years, with the outpatient or the admissions. the surgeries, the deliveries, whether it is cesarean or normal, the laboratory, the lab investigations, the routine lab investigations, I would say, the radiological investigations, everything is free of cost from day one. And in fact, we do all the surgeries, complicated surgeries, absolutely free of cost. Implants and everything, the consumables which they have to buy, because that is pharmacy which we buy as our own selves. But whereas all these services, the medical and surgical services, are absolutely free. In fact, we give something which is called as the it's called as Malla kit, and it's all about for the newborn baby, a girl born child. We give 5,000 rupees as DD, and we also give the basic necessities, whatever the newborn baby needs. And for a male born child, we give 2,500 rupees as a DD, and same along with the newborn necessities. Yes.
That's very inspiring, ma'am. So, I mean, I think this question would be a bit controversial, but we have seen that there are many fields which are male dominated since many generations. So, you have been breaking that barrier of women led leadership. So, how would you, advise or quote women to, break these shields and come up in spite of having multiple responsibilities?
Let me tell you one thing, that those era where the male has to be used to be more educated is gone, is no more. Now it's not about I'm playing a very little role, whereas our students, they themselves, they are getting motivated, and they are, women and men are getting equally educated now. Believe me. In fact, in medical education, I would say, to my surprise, we run two medical colleges, right? Women as well as co-education. Even in co-education, more than 50% students are women, are girls. So in women medical college, of course, it's 100% women. But even in the co-education, more than 50% are women. So that itself says, even in dental, not only just medical, even in dental, I think women are looking towards education as equal as that of men. And this is what is required. But then after getting educated, we women tend to get married and settle our lives, which is important. Yes, of course, career is one aspect. Woman is. I think this the entire thought process in a society, that after a particular education, the woman will finally get married, and the man becomes the he's the one who will earn, provider, or he will earn for the family, is still there. As I would say that this has to break through. And uh, the woman also, we should also, the men should also understand that marriage is for both of them. So both will continue to work, continue to take care about the household responsibilities. So it's all togetherness. It's not just like, okay, the man continues to earn, whereas the woman will keep her career aside and work for the family. No, I feel both should, after getting married, should plan their, the entire living, the way they live their life, is where both are taking care about the job responsibilities as well as the household responsibilities and the kids and everything, the family responsibilities. So it should be equivalent.
That's very beautifully explained, ma'am. So we have something called a medical entrepreneurship, which is gaining traction these days. So how would you inspire women to get into that field? Like you said, not just serving in hospitals or any other clinic. So how can medical entrepreneurship be a way for all the women?
No, I think women, which I told you, that women are in every field. They can do whatever they want to. So whether it is medical entrepreneurship or dental, whatever it is, I want women to explore themselves. They are, I would say, they are. Woman is a multitasker. So I think they're more organized than men. Sorry, but that's a fact. They can, the way they can manage the industries, they can manage the house together. It's, of course, it's a brilliant job. It's very difficult to do managing, because they both are different, and it needs a lot of patience. I think women have more patience than men again. So, so coming to this point, I feel that they can do anything. Anything is possible for a woman, and especially being a businesswoman is. I think they should do this. Coming into business is what they need to think about. Not only just medical entrepreneurship, but in every field. And financial support is what actually is the difficult. It's a challenging part for any woman, because once they get married, they go from their parents' house to in-laws' house. Parents are ready to do anything for their kids, but then comes to in-laws. The in-laws should equally back up their daughter-in-laws the way my father-in-law does. So he also backs me up, and he gives me the equal responsibilities as that of their his sons. So he considers me and my co-sister on the same part of that of son, and equal sense of responsibility, equal freedom is given to us. So whenever a woman wants to start a business, she needs a financial support, and I think the in-laws should believe in her, support her as equally as they support their sons, and so that they both can balance the entire business. Yes.
Makes sense, ma'am. That's a beautiful bond that everybody knows, like you said.
Yes.
So it completely makes sense. So, ma'am, looking at 2047, which is India's centenary year, so what's your vision as well as your institution's vision towards medicine, technology, and education as a combined system?
2047, everyone is talking about it, and yes, of course we need to talk about it. Uh, these years, like in coming 20 years, are absolutely crucial uh, for education system and healthcare system everywhere. There's a lot of things we need to do, especially as I told you, at one end technology is growing, and the old way of teaching is still there. So we need to merge these two and make our doctors or our students ready for the fast moving world. I want the students to upgrade themselves, whether in terms of education, skill, or technology, and keep themselves ready for the future. And that responsibility lies not only just in the universities, but also in the statutory bodies where they are dealing with, because finally we are answerable to them. I think a lot of changes will happen in coming future, and not only motivating them to be doctors or engineers or pharmacists, we need to motivate to the gap where we can see that, which I told you in the beginning, that it's all about allied health professionals too. When I'm running a hospital sector, we understand the deficiency, the gap. These areas we don't have people, and we are trying to use the nurses to use in that particular area. For example, endoscopy also, like the medical gastroenterologist or the surgical gastroenterologist, they try to train their nurses or try to train other basic life sciences professionals to, like for them to be a proper endoscopy technicians or laparoscopy technicians. But then why not have a entire separate stream or separate course where there is a BSc in endoscopy technology or an MSc in endoscopy technology or BSc in surgical laparoscopy technology and MSc as well. So this is what is the need of the hour. I mean, creating new education or new courses in the areas which we are in need of. That is one. Second thing is, of course, I mean, adding a lot of technology, integrating a lot of technology education or skill upskilling, skill development into the existing conventional education methodology. So these two are equally important. Yes. So that should be the plan.
Makes sense, ma'am. That's such an amazing conversation. Thank you so much for being with this.
So thank you, Vinila, for interviewing me. Of course, it was, I equally enjoyed this interview. And thank you, HMTV, for giving me this opportunity to talk about education and what the future of our country. Thank you so much.
Thank you, ma'am.